A publicly held medical device company, TransOne is pioneering an innovative transsacral approach to lumbar surgery. Its axial lumbar interbody fusion system, or AXIA-LIF, features breakthrough technology that allows for safe, reproducible access to the lumbar spine.
The mission of TransOne is to get patients back to their lives as quick as possible through a minimally invasive surgery that allows them to experience less pain and a lower complication rate.
Deanna Charette had grown tired of living with constant back pain. Her doctors prescribed all of the tried and true treatments to alleviate the aches, but nothing worked.
I was in the active duty military, and I had been active in sports also. And I experienced some pain that was so bad that I had problems sleeping and sitting and just performing my everyday functions. And we tried everything from pain medications to physical therapy, and finally the doctor said that I was going to have to do some lower back surgery.
Deanna is not alone. Each year, more than 15 million Americans suffer from chronic low back pain. And when medication and physical therapy fail, many people like Deanna become strong candidates for fusion surgery. This is the AXIA-LIF spine fusion procedure, the least invasive lumbar fusion surgical option available today. Pioneered by medical device company TransOne, this innovative transsacral approach to the low back allows surgeons to create a small incision, sparing all of the muscles, nerves, and soft tissue around the back, and allowing patients to recuperate and get back to living pain-free quicker than ever before.
The AXIA-LIF procedure is a novel procedure accessing the presacral space. You make a 1-inch incision next to the tailbone, and you advance into this pre-existing space, the presacral space, to get access to the L5-S1, the lumbosacral space, and take out the disc, put in the fusion material, and then put in an axial rod to hold everything together. Since there is no muscle dissection, there's very little postoperative pain, so therefore patients recover much quicker after this procedure. Also, this presacral corridor has no major vessels or nerves, and there's therefore very little risk of nerve or vascular damage. Finally, the fact that the outside of the ring of the disc is not violated, this allows for much better fusion. On the average, this procedure takes about 1 hour. The recovery time is very quick. Probably most patients go home the next day or even the same day.
Invented by radiologist Dr. Andrew Craig, the AXIA-LIF and transsacral approach is a relatively straightforward procedure, making it unproblematic for surgeons to learn, so they can pass on its many benefits to their patients.
In our academic institution, we teach our residents how to perform different types of spine procedures, and the AXIA-LIF has been the easiest for them to learn. This is likely due to the fact that the presacral space takes advantage of native anatomy planes with very easy dissection, very similar to the one, for example, in the anterior cervical approaches. And once the cannula is inserted, the rest of the procedure is safely performed through it.
I had my AXIA-LIF surgery a year ago, and about a day and a half later I was up walking around, and matter of fact, about 2 weeks later I had a cross-country trip on a plane, and I was pain-free, taking a two-week trip cross-country. I feel 110% better, and I do recommend the AXIA-LIF procedure to other people, and Dr. Tender did do a wonderful job for me.
I have had very good results so far with the AXIA-LIF technique. Blood loss is very little. We have less than 100 cc's of blood loss, which is important sometimes in older patients or patients with other problems. And I have started to expand the indications for this particular technique to older or sicker patients that otherwise would not benefit from, let's say, a transforaminal lumbar interbody fusion, which is the alternative to the AXIA-LIF fusion. As a neurosurgeon who performs a lot of spine surgery, the AXIA-LIF procedure is one of the most gratifying because the patients do very well, the results are excellent, and it's relatively easy to perform.
The level of care that I received from Dr. Tender was terrific. I felt that I was in good hands with him, and he had explained the AXIA-LIF procedure to me totally, that I totally understood what was going to happen. I'm sitting for a long period of time. I'm able to walk my dogs, and in the near future I'm hoping to get back into my martial arts. and to be able to get more active in things such as running and back into my water sports again. If someone's a little squeamish or skeptical about having the AxioLift procedure, I would recommend that they go ahead and go through with it, because it's been the best experience of my life, and I would go through with it again 110%.
I would tell anybody out there suffering from back pain that you should talk to your surgeon, you should understand all your options and educate yourself on various fusion procedures, and know that AxioLift is the least invasive solution to lumbar fusion. It offers less patient pain, lower blood loss, and allows you to get back to your lives quicker.
If you're tired of living with chronic low back pain, learn more about this AxioLift procedure developed by TransOne, offering the least invasive solution to lumbar fusion. For more information, visit transone.com or call the number on your screen.